Let's talk about the 5 main training factors for success as a neurofeedback provider. I'm Dr. Trish Leigh, and I'm here to teach all of you who want to be neurofeedback experts exactly what to do to get success with your clients. So let's dig in. Okay, now what you'll find is that in the 5 main training factors that we're going to talk about, there are going to be some that are very important to you as a provider, and then you'll learn that others that maybe you think are important are less important than the others we're going to talk about. And what we are talking about in terms of these factors is client success. And client success is measured by how much a person's brain performance pattern improves and how much they have symptom reduction or increase in the way that they feel and perform. So we want our clients to be successful. We're going to learn these factors. So let's dig right in. Training factor number 1 that you're going to find out isn't the most important factor is the type of feedback that is provided to your client. So the types of feedback that we're talking about are auditory, visual, or a combination of the two. Now, auditory feedback is to the ears, visual to the eyes, and then when we combine them, you might think that that would be even more powerful to your client, but a scientific study shows that it's not. That none of those feedback modalities is statistically more significant than the others. And I will tell you, there's one study that shows that using the combination of auditory and visual feedback together can be a little bit slightly more powerful for some people. But another study shows that if you make sure that you don't use a feedback modality that your particular client has an aversion to, that you will create more success for them. So what that means is if you have a client who has auditory sensitivity, don't use audio feedback. If you're working with a client with a head injury, we know many times the screens are too much for them. Only use auditory feedback. Don't use visual feedback. Okay, so I'm describing this in this video, but at my blog post at drtrishleigh.com, you will find all of this written and the link to the scientific study, as in case you want to know exactly where I've gotten this from, because I am the messenger, the science speaks. Okay, let's move on to modality number 2. Modality number 2 is an important one. It is the intensity and the frequency that neurofeedback brain training is delivered, especially at the outset of a program. So what that means is if a client starts to engage in neurofeedback and they're able to do neurofeedback sessions day after day after day consecutively, that can create bigger changes, especially upfront for that client. And that's why I call our programs at Leigh Brain and Spine our Brain Shift programs, because they're designed to shift a person's brain out of the brain performance pattern that they're in when they come to see us, which is giving them whatever challenges they have, into the optimal pattern. And of course, we want to do that as gently, but as quickly as possible so we can get the gains for the client. That's why my Neurofeedback Experts Direct program, as you'll see on my website, is so important. So if you don't offer neurofeedback that clients can have unlimited sessions at home, now might be the time for you to add that. That's what we do. We have clients come into the office if they live within proximity of our office, but we want all of our clients to engage in our home program also. And now I'm able to do that home program for offices across the world. You don't have to do a thing. We do it for you. And the whole goal is to make it so that your clients can get this frequency and intensity upfront, because people need it to get better. Now, what that does for you as a provider is you help your clients get the outcomes they're looking for, and they refer more patients to you, and everybody is happy. It is a no-brainer, pun intended. Okay, moving forward, the next third variable that we're talking about is the protocol choice. Now, this is an interesting one, but follow me for just a second if you can. Now, of course, choosing the appropriate protocol is one of the most important factors that you will find to create success for your clients. So, based upon their brain map or their baseline brain performance pattern, you want to be able to choose the protocol that is going to inhibit the speeds that their brain is using too much of, that is going to boost up the speeds their brain is not using enough of, to balance out the brain performance pattern and get it as close to the optimal pattern as possible. So that hopefully is obvious. And if you're not skilled at that, I can help you do that also. I interpret people's brain maps for them. I interpret their neurofeedback trend screens. It's super affordable and easy, and it will take your practice to the next level. But make sure you're doing it correctly, because that's how you're going to get the biggest bang for their buck for your patient. But also recognizing that the science shows that there's some protocols that will help a brain shift faster than other protocols. So for example, if you're inhibiting theta will come down faster and easier, and science shows it will move significantly, and that will be easier to get the outcomes for your patients. So we know that people with ADHD and ADD, and all the science shows that brains respond really well. People are able to reduce their symptoms to none. There's very little regression, and there's no side effects when it comes to neurofeedback. We know that as providers. But what you may not know is that moving alpha can be a little bit more difficult, and the science shows that. So analyzing a brain map for alpha, especially in clients that have depression or chronic anxiety, that can be very important. So you want to analyze it appropriately for alpha, and then secondly, recognize that it may not move as much in your data, which science supports that, but I've seen this anecdotally, that with smaller moves in the data, you may also be able to create bigger qualitative changes for the client, which means that they perform and they feel better, even though their alpha didn't move as much as theta might move in your measurable graphs. So make sure you choose the right protocol, and then recognize different protocols have different success rates. And we know that because we know helping people with depression might be a little bit more challenging depending upon the protocol. But recognize your data might move differently too. Okay, so moving on to the fourth factor after protocol is the number of frequency bands and the combination of the protocol that you've chosen. Now, this one might be a little less intuitive. What it means is that many times we'll pick a standard protocol that's a combination of maybe inhibiting theta, inhibiting high beta, and boosting low beta, alpha, or SMR in the middle. And I love those protocols, I really do. But what science shows is that for some people, you can create more success rates if you're just boosting SMR. And many providers will go with an SMR up before they inhibit the frequencies that are on the opposite sides of SMR, high beta and theta. And if you just think about it logically, if you're trying to boost SMR in the middle, but you're also pulling these two bandwidths down that might not be that far away from the bandwidth that you're increasing, then you may be pulling two down and trying to pull one up, and you may be less successful. So look at your data and make sure that you think you're pulling it up as much in the middle. And if not, you can take these two frequencies away, because science supports that one frequency band can get you greater results in the end for some clients. Okay, so lastly, the fifth training factor that can be very important for creating success is the position of the sensors for training. Now, you want to make sure that you're putting the sensors on the appropriate site based upon the brain map or the baseline brain performance pattern, which is generally the brain map. You want to make sure that the sensors are isolated in the area where the training is deemed the most necessary, and where through your analysis, looking at trend screens, you've seen the strongest response to intervention, which means a site that shows that that brain is shifting really well. Now you want to make sure you're on that site, and I've had this experience many times anecdotally, and I don't know if anybody out there has, but sometimes if you move the sensor just a tad to the right or to the left, that you can see very different magnitudes of the speeds that are being used and a very different response to training. So make sure you're nailing the site exactly where you need to and check your data to make sure you're on track for that. Now remember, the reason we care about these 5 training factors is because we want to set our clients up for success. Success is measured by changes in the data and of course that they show up as self-regulation skills, symptom reduction for your clients so they feel and perform better. Okay, I hope this information has helped you out as a provider. And as always, we want to get out there. We want to change brains and improve lives and make money doing it because it is our mission. So get out there. And if you have any questions, email me at trish@drtrishleigh.com, or you can email my team at info@drtrishleigh.com. We're always happy to answer your questions and help. Okay, go get them.